Your internship year is a lot to handle. It's not just a simple year. And who is in your internship and who is guiding you through that process can impact your life, not just in your career, but also in your personal life.
When students are looking at dietetic internship programs, we all have the same areas that we're going to cover. Each student's going to be in a clinical setting, a food service setting. But what makes our program unique is we really want to know each student on an individual level. We want to partner with the student to develop those strengths even more, but also come alongside of them in their weaknesses.
Internship programs by design, they really have to have, and really from the Academy of Nutrition and Dietetics, you're required to have certain rotations, you're required to spend a certain amount of time in the various aspects of nutrition, but it still felt very personalized. I was able to do the things I was interested in doing. I spent a long time in an inpatient setting in a local hospital, mostly because I asked to. So it really was a tailored experience at Samford.
I want each of my students to become very successful. I want them to become dietitians who know a lot about nutrition, who love the people in their community, love their clients and patients that they work with. But most importantly, I want them to know that they have been given this skill set to make a difference. So students that see not only what they've read in a textbook, what they've studied in a class, but can really impact somebody's life for the better. That's what I get excited about.
Seeing sick kids made well, I mean, that is such a simple concept, but that's the goal, that's our job, that's what we're doing, and it's not something that you just clock in and I wear this hat from 8 to 5 or whatever your time frame may be, but it's something we think about all the time. It's a thrilling job, it's very rewarding and encouraging.
I just accepted a role as a trainee where we are piloting a telehealth program for children, and this is for children who are underprivileged and they are obese, and they're going to be working on a weight loss program. And even though it's through a computer, I'm excited for those potential connections to be made with the kids and hopefully to have success and to help them manage their weight and to learn healthy habits that they can spread throughout their communities and with their families. The whole career of nutrition to me as a Christian can be to not only help people, but when people open up about their food habits, they often open up their hearts too. And I feel like Samford taught me how to do that better, how to implement care through nutrition as a professional, caring for people's hearts. And that was done for me as an intern. And it wasn't a simple, just the internship or just my preceptors or just the direct, it was just the whole component of it, which is perfectly woven together and all worked out in the best possible way.